Hello, everyone. Welcome to another episode of Arthritis at Home. In fact, our last episode of 2021. And as is ACE's custom, we like to share with all of our members and subscribers and partners our plans for the next year. And to do that today, we have Cheryl Koehn joining us, President and Founder of Arthritis Consumer Experts. I'm Kelly Lendovy, VP of Communications and Public Affairs here at ACE. So Cheryl, I'm going to ask you to walk us through some of the highlighted work areas, focuses for ACE's work plan in 2022 over the next 12 months. And just as an intro for our viewers, we spent a lot of time putting together these work plans and really taking into consideration what's occurred over the past year and what we anticipate for the next one. And obviously the big one for us over the last 2 years, and again for 2022, is this pandemic that's hanging over us and how it's forcing governments to change the way they operate, the way they deliver healthcare, and there'll be sort of long-term ramifications, consequences of that as well. But we've also seen other sort of major transformative changes over the course of 2021. And that would include the increased use of virtual care and that continued integration, and the introduction and wider spread use of biosimilars. So the medication landscape has changed for a lot of arthritis patients, particularly inflammatory arthritis patients. So we carefully consider all these things and put together this work plan. I'm going to turn it over to you maybe to start by asking you just sort of what are those sort of underlying goals or objectives ACE has when we go through this exercise, in particular as it relates to next year in 2022.
So thanks for having me on, Kelly. It's my pleasure to be here and to share some of the deeper thinking that has gone behind our work plan coming up for 2022. And you asked about the underlying goal, and really for people like myself living with one of over 100 different types of arthritis, not just here in Canada, because there's no borders to the internet. Obviously, people around the world do tap into our programming and rely on it. It is really how the healthcare system is working for us. I mean, so our overarching or underlying goal is to make sure that that journey, to do the best that we can in the work we do, to make sure that that journey is as seamless and as high sort of functioning, if you will, for people who need it, like myself and millions of others here in Canada and elsewhere. And I think largely, we've been doing a lot of work for a number of years, and people probably wonder, why are they still talking about models of care? Well, a model of care is that journey. It is the healthcare system's map for us that we go around. Think of it as a monopoly board, right? You're going around the monopoly board, and hopefully you're winning in your healthcare outcomes as you go around the board. And what we know to be true is that we're not, that there are gaps. You land on pieces of the game, of the journey, Kelly, where there's simply no service for you, or the service is so disjointed that it's not delivering to you what you need from it as a person living with disease, whether it's getting to a rheumatologist on time or having a seamless transition to a physiotherapy expert or an occupational therapist who has training in arthritis. It's the person up in rural, remote areas in Canada, Kelly, who have access to none of that, who have to travel 600 or 700 kilometers, who, when they're told they can have a virtual care appointment, can't get broadband access. So it's all of that, Kelly. It's all of those pieces coming together to make a model of care, and trying to work on those pieces. That is our underlying goal.
In terms of our members, in terms of people living with arthritis in Canada, we had an opportunity to listen very closely to them through our work with national surveys in 2021. What kind of role did those surveys play in the creation of our work plan for next year?
I think three real strong themes emerged from the survey program from 2021. And that is just this strong ongoing need for education and advice on understanding the actual disease states. And I'm not suggesting that people who have been living with their type of arthritis for a long time don't understand it. What those people want, and what we learned from the survey, was they want to know about the research. What's the breaking research about that disease? What is the stuff that we learned last week that may help inform their decision-making about, let's say, a treatment change, or, trying to tap into a new type of healthcare professional's expertise. Or it could be for the person who is newly diagnosed, Kelly, who wants the full meal deal of information and education. So we're serving members who come to us at any given point in time, who either are just starting out, they just got their disease, they're overwhelmed, they're awash with fear and indecision and loneliness, depression, like all those things that happen to you when you get a significant diagnosis of arthritis, or that very experienced person who may just be looking to fine tune their education a little bit, right? They're in their information needs. We also, wanted people want to know how this research then relates to decisions they're considering and taking. And that process is actually the way that we, as people living with a health challenge, no matter the health challenge, increase our health literacy. So it's a big topic of interest for ACE. It has been a long, long time. It's not just about giving people education information. It's about trying to support them and then taking that information, reflecting on it, weighing the pros and cons for themselves, and then taking a decision and taking action. So that came out loud and clear in our survey program. And then, as you mentioned, and these are not, by the way, in rank order, they're just the three strongest themes that we found from the survey results. And that is around inequity. And I think most of our viewers know, you certainly do, Kelly, as our VP of Communications and all things editorial, that we are 100% committed to closing the gaps in the community, in the BIPOC community. And clearly, with truth and reconciliation and reconciliation top of mind for our organization, for being the best ally that we can be to Black people, to all people of color, no matter age and no matter geographic location. So we heard loud and clear that the things that people who have power, who have socioeconomic status, who have white skin color do far better, and that's not good enough. It's 2022. We're right on the cusp of turning into 2022, and this will change. And ACE is going to be a part of making that happen. That is what we're committed to. So those are the sort of key three themes, I would say, that came out of our survey program.
And I think we should point out with our surveys is there's an opportunity not only for them to directly answer questions. A lot of times there's opportunity for them, the respondents, to provide us their personal comments. And it's really those personal comments. And we want to thank everybody who's taken the time to complete a survey. If you haven't, and there's future surveys, we really want you to participate. But it's that commentary, that feedback that we get. Sometimes it shocks us, it motivates us, it provokes us.
Makes us cry. I mean, some of the things we hear are really so profoundly sad about where people are getting stuck in the healthcare system.
We all go into Cheryl's kitchen and then we start looking at these findings from the survey. We talk about the urgent issues that we've identified. And then we bake a plan, and this plan consists of several work areas that will be our focus for the upcoming 12 months.
So first and foremost, we have a set of activities here at Arthritis Consumer Experts. They're called core activities, and they're branded or named under the Joint Health family of programs. So our Joint Health Insight, our newsletter, our Joint Health Express, that's our breaking news bulletin, our Joint Health website. So everything that sort of falls under that Joint Health information education banner is going to be really fundamental to driving out the things that we're going to do. We, of course, are going to continue our national survey program. It is the mechanism, it is our tool, organizational tool, to every day collect voices, collect the experience of arthritis, and look at it, measure it against last year and say, is it changing? Is what ACE is doing changing the experience of arthritis? And as you know, that's our tagline, changing arthritis.
You spoke about models of care at the opening as sort of an underlying theme for us. And it's obviously a key part of the work plan.
Yeah.
There are a couple of particular programs that we're looking at for 2022 that maybe you want to talk a little bit about as it relates to our work in improving models of care.
Yeah, so we're going to take some work, really, I think a really successful piece of work from 2021, which we did in collaboration with our fellow patient partner organizations as a sort of a final and legacy project from the Arthritis Alliance of Canada. And we visited with 6 provinces, Kelly, with a number of different branches of government, clearly the Ministry of Health, but also those branches of government who are looking at developing virtual care platforms and how those can best meet the needs of people with arthritis in these provinces. So we met with a whole pile of senior civil servants and elected officials, both who were forming government as well as opposition. And we shared with them the Arthritis Alliance of Canada's model of care toolkit. We brought in health professionals with us, as you've said, Kelly. The best way to talk to government and to get across the needs of people with arthritis is to do it as a village, is to do it with people like myself and yourself, but also sitting next to our health professionals of a variety of disciplines to make certain that they know that we're speaking from one voice, right? It's so important for policymakers to understand that our community is coming to them united. And in fact, we are. So we're going to carry that on. We're going to present these outcomes from sort of part 1 of this model of care summit tour that we undertook in 2021. We're going to present that at the upcoming Canadian Rheumatology Association and Arthritis Health Professions Association meeting. And then we're going to carry that into phase 2. And that is, we made specific recommendations to policymakers, Kelly, around virtual care, around the types of gaps that existed in models of care in the provinces that we visited in. Part 2, the second piece of our work, is going to be to work with our Arthritis Health Professional Association and Canadian Rheumatology Association to compel government to model their healthcare in rural and remote areas so that the healthcare system actually functions the way it should for people like us, so that care is integrated, that it is seamless, and that we do utilize health professionals such as rheumatology nurses, physiotherapists, and occupational therapists in ways they are trained to do, but are not currently being used and not currently being funded to provide those services. In other words, lifting a burden off of really overworked and underrepresented rheumatologists in all of the regions that are where services are needed, and utilizing healthcare professionals, Kelly, that can do the job, that can help augment or extend the services of a rheumatology model.
When you also speak about reimbursement access, one of the changes in the landscape across Canada over the last almost 3 years has been the introduction of policies around biosimilars. Is that something that ACE is also going to be focused on in 2022?
And ACE has been working with governments, provincial governments, specifically drug plan leadership and ministers of health, to carefully craft biosimilars policy, both New Start policy and transition or switching policy, that better meets the needs of all Canadians, not just those that are privileged to be on an originator, right? So a lot of money has been thrown out the window, and we keep challenging government and saying, why? You know, those funds are very important to be reinvested back into these models of care pieces that we've been talking about, Kelly. You know, to have billing codes for nursing, to list new products onto drug formularies, public drug plans that are currently not being listed because they're cash strapped. And this is particularly true now because of the pandemic. So that really sums it up, Kelly. Those are sort of the big high level pieces. There are, you know, many details that flow beneath each of those broad work area topics. And we just look forward to engaging with every one of our members and subscribers and social media followers in 2022 to make sure that we do the very best that we can. You know, we're a small, lean team of people with arthritis who also are professionals in the health education space. And we just can't wait to get started in 2022.
Well, thank you for that excellent summary and the behind the scenes work that's going on in that kitchen over there. I'm excited. I hope our viewers are excited. It's an ambitious schedule of work, but it's also something I think that ACE is known for, is tackling the tough issues and spending the amount of time, investing the amount of time and blood, sweat, and tears to make a difference and to continue to change arthritis, as I know you're fond of saying.
Yeah, you know, Kelly, I just want to say one thing before we sign off. The things that we've just talked about are the very things that drive out the actual pieces of work we do. And I hope that our viewers find what we've just shared relatable. I hope they understand or can see themselves in these areas of work and understand where they're going to get value from us as a not-for-profit working in the space of arthritis. I think if they can't, they have to let us know, right? Ultimately, we're accountable to 6 million plus Canadians with arthritis. And we are fearless in our accountability. We want to hear the good, bad, and the indifferent in some ways. Those are the things that drive us to be better.
To everyone, all our viewers, we want to wish you a great holiday season, but most in particular, a safe holiday season. So we look forward to seeing you again in 2022. Cheryl, thanks for joining us.
Thank you.